which surgeries do you believe are worth getting?
I think there's probably a lot of operations out there that are very effective. And the examples that I give in the book, a classic example is cataract surgery. And I like that example because it is very common. It's hugely common. I mean, cataract surgery is done all over the world, even in developing countries. It can be done for like a few dollars, literally a few dollars for the lenses, and people donate their time. And so you get a lot of eye surgeons who travel around the world doing this procedure on an industrial scale. And it's a procedure where you can actually test someone's vision beforehand, and their vision can be very much impaired. So they have very poor reading ability. You pop in this lens that you can buy for a few dollars. You can do the procedure under local anesthetic in a short time. And these days, it's such a common procedure that it's really bread and butter, reasonably safe surgery for most eye surgeons would do, hundreds of these, if not thousands. And you can test their vision afterwards, and it can be excellent. And so you've got someone who can't see and now they can, and you've done it for a few dollars. So to me, that's a good example of how surgery can be a good, can do good in the world. There's lots of other examples, but I just like to highlight that one because it's widespread, it's cheap, and it's very effective. Now, there haven't been any placebo studies comparing that to not doing it, but the outcomes are fairly objective. So I don't think you really need to do the study, because if you've got someone with really bad vision from a cataract, you can do nothing to them, and I'd be pretty surprised if their vision got any better if you didn't do anything, because it's not the kind of thing that gets better on its own.
Do our minds have the power to influence our health, and can they get rid of diseases?
Certainly our minds have the ability to influence our perception of our health. So when it comes to subjective things like pain would be the biggest one, but also mood, depression and how we feel. But pain is a big one because a lot of surgery is done for pain. And yes, the mind and as a general concept, but our circumstances as well can influence our level of pain, and particularly how we react to the pain. And one good way of thinking about this is contrasting pain to suffering. And I've been around for a long time. I've seen lots of people in pain. I've seen lots of people with broken bones and with painful conditions. And the reaction to this pain varies quite a lot. And so arthritis is a good example. You can see people with arthritic changes in their back or in their knee, which is fairly common. And some people just cope very well. It hurts, but it doesn't worry me too much. I know what it is, and I'm happy with it, and I just sort of get along with life, and I adapt, and I sort of work around it, and it doesn't influence me too much, and I don't get depressed about it, and I don't lie awake thinking about it. And you can get somebody else with the same or even less severe arthritis who his life is ruined because of it, because they're just kind of like, oh my God, it's terrible. I'm going to end up a cripple. I just, every time I take a step, I can feel this pain, and it's just worrying me so much. I don't know what's going to happen to me. And these people are miserable. And yet somebody else with the same condition who also has pain every step they take doesn't worry about it so much. And so there's a huge spectrum of how people react to pain, and a lot of that's got to do with the circumstances they're in as well. A lot of my research looks at compensation, the effect of compensation on people's health and people's pain and response to surgery. And that's not a well understood phenomenon, but certainly it does make a difference. The blame. So, for instance, if you were in a car accident and you were backing out of the driveway and you backed into a telegraph pole or something, and there was no one else around, and you did it, and you kind of hurt your neck a little bit, and you'd feel like an idiot because it was all your own fault, and you're kind of like, oh, what am I doing, and your neck might be, hurt a little bit for a little while, but you're not going to pay any attention to it, and you're too embarrassed to even talk about it. And then maybe 6 weeks later, you might not think about it that much, and then I still feel a little bit in my neck, but that's not worrying me that much. It's not as bad as it was before, and I'll get over it. And then you never pay any attention to it again. Same thing. You're sitting in your car, and instead of you backing into a telegraph pole, a person drives into the back of you while you're waiting at the lights. It's exactly the same mechanism. It could be exactly the same amount of force, and you could have exactly the amount of pain in your neck at the time. But if it's someone else's fault, it's kind of like, I've got this neck pain in it, and it's all his fault. What an idiot. I hate that guy. I can't believe he did that. I'm going to sue him. I'm going to make him pay for this. This is terrible. Look what he's done to me, And then 6 weeks later, when you feel the pain, just like you would have anyway, you're kind of like, oh my God, it's been 6 weeks and I'm still getting the pain. When's it ever going to end? This is ruining my life. And so your reaction to it is completely dictated by the circumstances of the accident and who you blame, rather than the mechanical force that caused it. And so these are just a couple of little sort of thought experiments that show you that pain is, well, I guess it's subjective. It depends on a lot of things.